We have Dr. Marcella Ogenchuk from the University of Saskatchewan with us here today about some exciting news in the forefront of wellness in Saskatoon. Thank you so much for coming down to the studio.
Thank you for the invitation.
I want to talk about yourself and this project that's happened at St. Francis School in Saskatoon. It looks like it's on the cutting edge of good news and delivery of clinics and wellness to students in that area.
It is cutting edge. My understanding is it's the only school that has a wellness clinic built into it in Canada. It's a Cree bilingual school, and it serves around 700 students right now from pre-K to grade 9. So that's a new thing too, because we have students in grade 9 where in Saskatchewan usually it goes till grade 8.
And you mentioned at some point that there was there's the English and Cree components to it, but there's also some symbols and I guess a way that people would feel more at home in their own culture seeing things in the school.
So the school came to be with a partnership. I'm just one piece of that partnership. And so the partnership includes elders from the community who have guided the build. And so I can only talk about our wellness room that is a part of this school. And so when we met together to design the wellness room, the elders presented the vision as to the overall theme as to what they wanted in there. And so yes, there's syllabics in there. And when you enter the wellness room, the syllabics right over top, the entrance is that healing occurs here. So it really guides the way that we do work together and work in the clinic. And I call it a clinic because at the front it says nursing clinic, but actually it's a family and student wellness room.
And if you're talking about that service delivery, is it just the kids attending the school there, or does it extend into moms and dads, or if I'm picking up my child, that I would also have access to care there?
That's a really good question, because nothing is done without the family. The family, as they guide the students in the school, we do nothing without the students and families' informed consent. So even if the students come to us, we communicate with the families all the time. And the wellness room is actually built in a non-traditional fashion. So when you walk in, there is a place to sit and communicate, and there are rooms, but the rooms are larger than normal rooms, so that the students are never alone and the families can come with them. So as far as the plans right now, we are informed by the community and what the community needs. And we started here in their old school, I'd like to call it, it was about 17 years ago. And we were actually asked to come in because of some of the things they were seeing. And literacy, of course, reading levels are very important in education. And so what I found is that they were having difficulty assessing reading levels because many of the children are not able to enunciate, so they couldn't tell if they were saying the words or not.
Oh, yep.
So once we realized that early childhood caries is the #1 reason for children to go to the OR, and this is Canadian-wide, it's not in this community, we're able to place it into perspective, and we started a partnership there. And that started some of the things we were doing with the College of Dentistry is, of course, sending out all the consents, and we just did assessments in the school and provided the information to the parents. So then the parents get to choose how they would like to get the care done and where they get it done. So today we've moved it just from assessment to doing fluoride varnish, which is the #1 way to prevent caries. So we're moving from treatment more to prevention and teaching students and their families self-efficacy skills in the healthcare system so it improves their wellness. I would say that would be kind of a summary. So yes, my answer is it is students and families. And teachers will come in and ask for topics or maybe resources to use in their classrooms. So we help with that as well. And of course, it's all informed by the evidence and the most recent evidence that we can find to give the children and their families the best resources to improving wellness.
I like the fact that Saskatoon is first again in doing something that's, I guess, groundbreaking in one sense, and doing things a little differently. I guess what I'm learning here is that there's a clinic inside a school. Mm-hmm. You wouldn't necessarily go to get your appendix taken out, but what types of things would someone come and see the nurse practitioner or the team there for typically?
Yeah, so it's important right now is that we don't have a nurse practitioner in the clinic. It is myself. I am a registered nurse with, I'm licensed in Saskatchewan. I have done primarily most of my work in acute care. But we do have resources at the emergency where we can refer. We have specialists, and there's also a social pediatrics clinic at St. Mary's with pediatricians working there, so we have access to speak with the pediatricians there if we need to. Mm-hmm. So there's also an optometrist at St. Mary's that we can refer to, and public oral health supports us hugely. Like we provide toothbrushing programs and toothbrushes to the students and start toothbrushing programs in the school. So that is actually World Health Organization recommendation to prevent early childhood caries. So we're really trying to do those upstream approaches. And yes, I would say that this school is a leader. I can say from my point of it is that I feel as part of the team. As a visitor in the school, coming from out into the school. And so what we do have is nursing students as part of the clinical there. So with me, right now, there's 8 nursing students. And so the nursing students have learned that we use theory to guide our practice. And so with my supervision and the teacher's supervision, there's a real interprofessional collaboration going on, and they learn well from the teachers who communicate so expertly to the students on how to teach. And so the nursing students are also learning, because part of being a nurse is educating, right? Mm-hmm. And educating before patients go home. So they're also meeting a lot of the students where they're at, and they're seeing the needs before they get to hospital, so that they know the backgrounds of some of the patients they will be seeing. So it's a win-win because students learn about truth and reconciliation firsthand. They get to work with the elders and ask the elders, how do you think we should be teaching this in the classroom? And the teachers appreciate the breadth that we come in with and the respect that the nursing students are taught for culture, because we know that culture influences health, that people who are allowed to practice their culture, it improves health. It's evidence as well. So the students learn things outside of their own culture that they're used to, and they see things that they otherwise wouldn't have the capacity to have done that. And they have firsthand experts, the elders, to go ask, how do you think we should talk about this controversial issue in the Catholic school, and knowing everything that's happened historically? And that synergy is not something I can explain. It's something that they experience, which I call experiential education.
I think it's remarkable, just in the way you've shed some light on that growing up in the school system, that the teachers that you're there with day in and day out for 200 days or so, they're intricately aware of the child, in their progress and being able to network them. Sounds like there's a very comprehensive network behind you as well. You said you're part of the team. How many 725 students roughly in the school?
Yeah,
more or
I think
less?
yeah, it's around. I know it's around 700.
Yeah. And are you seeing that could be the transplant of that knowledge and what you're developing there? Could that be portable to another city? If
I
someone wanted
I
to do
think
that?
the model
Yeah.
could be. It's really the Greater Catholic school system and this group at this school, which has been led by parents, right? For parents that have really driven the impetus of this school and how it should be built and what should be built. It was really a lot of meetings with partners. So, like I said, I feel like a piece of it. I gave input into how I thought the clinic should unfold, and they took my ideas along with their ideas, and this is what we have right now, which I think is the beauty of it. And nobody went into it for themselves. It was for the children, right? It's for the future. It's for the future children coming. And so I can only speak as to what a wonderful opportunity it was to work with these individuals and to experience this process. So when you talk about moving the model, yes, and I think that they would be willing to share how they did that with other people who want to do it. And I know that they had many ideas because I went for a tour of other schools with them. To see how wellness is achieved in other schools in BC and in Calgary before it was done here.
Implemented here.
Yeah.
If someone wanted to find out more information about that, would they go to, we'll put up your information on the website?
Yeah, absolutely. Anything to do with the wellness piece, I'm happy to answer questions. And I know that Greater Catholic School Division has all the information about the school up as well and videos on their process as well.
Perfect. Dr. Ogenchuk, thank you so much for shedding light on this. Congratulations. It's a beautiful project.
Thank you for the opportunity.
That's our show for today. I'd like to thank our guest, Jackie Tischer, as well as Dr. Marcella Ogenchuk. I'm your host, Randy Shabila. We'll see you next time on Connect.